Hafaday, good morning, everyone. Welcome back to the Guam Congress building. The Committee on Health, Land, Justice, and Culture is now called to order. Today's Friday, May 10th, and the time is 8:37 a.m. In compliance with the open government law, notice for this public hearing was published in the Guam Daily Post, posted to the Guam Government of Guam Public Notice Portal on Friday, May 3rd, and Wednesday, May 8th, 2024. Notices were also sent by email to all senators and all main media broadcasting outlets, and this hearing is being live streamed on the Guam Legislature's YouTube channel. This is a hearing for Bill number 289-37 LS. It was introduced by myself. It is an act to adopt the 51 new hospital fees proposed by the Guam Memorial Hospital Authority and received by MINA TRENTAI SIETTE LIHESLATURAN GUÅHAN on April 11, 2024. The bill was introduced by myself for the purpose of giving any stakeholders the opportunity to speak on the 51 new hospital fees recently proposed by the Guam Memorial Hospital Authority pursuant to Section 80109, Chapter 80, Title 10, Guam Code Annotated, which allows GMH to conduct its own public hearing, which they did on March 19th regarding new fees, and subsequently submit those to the legislature, which they did on April 11, 2024. According to the statute, the legislature has 45 days from receipt of proposed fees to conduct a public hearing and approve the fees, or they are enacted by default. So currently it's 28 days since receipt of these fees. These fees, there are 135 new fees. Sorry. Just an overview of the fees that have been adopted by GMH in 2023. In January, there were 135 new fees passed by Resolution 2023-24. In April 2023, there were 65 new fees passed in Resolution 2023-61. In August, there were 73 new fees and 22 proposed room and board rates passed in Resolution 2023-61. In October 2023, there were 202 new fees and 16 proposed fee adjustments of oxygen supplies passed in Resolution 2024-06. December 2023, there were 48 new fees passed in Resolution 2024-15. So this bill, again, is to adopt the proposed 51 new fees for several departments at GMH, including interventional radiology, special services, laboratory, intensive care unit, operating room, surgery and recovery, and pharmacy. These fees are, according to the documents, related to supplies, medicine, room accommodations, and professional fees. The fiscal note from BBMR, the Bureau of Budget and Management Research, on May 8th says, the proposed fee schedule will pose a positive fiscal impact on the revenue generation of the GMHA. And GMH reported that the estimated net fiscal impact is $0.4 million in revenues, comprised of $3.4 million in gross revenues and $3 million in costs to purchase new supplies and medicine. I'm going to ask GMH to explain that a little bit more. But we have no written testimony that we have received on this, so I'm going to ask GMH if they would like to present testimony. I want to welcome our acting CEO of GMH, Dr. Prince. Thank you for being here and with all your team. Please present.
Thank you, Madam Speaker Hafaday. And my team consists of Jordan Paloon, our legal counsel at GMH, and I have Yuka Sachanova, our chief financial officer, and I have Saidi Taisiken, who is her revenue cycle management. I'm going to allow them to talk, but thank you again for this time that we have to be here.
Thank you as well.
Good morning, Madam Speaker.
Morning.
I'm just here today, of course, to support the fees and really here to answer any questions that you have. We did have the public hearing. Most of the insurance providers do attend the hearing. I think Select Care is the one that said that they would submit written testimony, but we didn't receive anything in the timeline. That's it. Thank you.
All right, I had just a couple questions. So this is pretty routine. It's been in statute for years. It's been going on, but there were some fees, not this one, but a packet in earlier months that were highly objected to by some of the insurance companies, and so I just decided as a matter of policy to have a hearing on these, so to allow them one more opportunity to put in their testimony or their input. So the last fee package adopted by GMH was in December of 2023, and this is the first one for 2024. How often should we expect these new fees to be promulgated? And how do you determine when a new fee is needed or when an existing fee needs to be amended?
The hearings we have quarterly. We have them quarterly, and then it is the servicing departments that send the request for a new charge code whenever there's a new supply that they need to use in their departments.
Okay. Fee number 40 is described as COVID-19 vaccine Comirnaty SDV. Is this a COVID-19 vaccine? And it's GMH is charging $272.82 for a vaccine. These vaccines are no longer free to the public?
Senator, so this is a medication. This is not a vaccine, but it was just labeled as a COVID because it's stated in their packet as a medicine.
Okay. So it's a treatment after you have COVID?
Yes, it's a new set of medication.
Okay, thank you. Under the interventional radiology department, specifically fees 2, 3, and 4 are new fees for room accommodation, and it shows that you charge $153.52 for every 15 minutes for minor surgery and $332.70 for every 15 minutes for major surgery. Then for minor surgery, there's a charge of $920.97 for the first 30 minutes. And can you just explain where this was derived, this fee model was derived from, and is it typical for patients to be charged by the minutes as opposed to hours or days?
So this services is derived from APC, which is the ambulatory procedural cost. So we derived this because we just recently opened an angio suite under interventional radiology. So these services is specifically assigned for a minor and major surgery. So this is like a something new charge for GMHA.
But this is how it's charged in other hospitals?
Yes.
By the minute?
It's by minutes.
Okay. All right, and then we talked about Calvo saying at your public hearing that they would submit testimony. You received none, and I have received none as well.
That's correct.
Okay. All right, thanks. Is there anything else that you'd like to add? Those are all my questions on this.
Coming from the specialist side of the view, yeah, so these are, with the 15 minutes, that's exactly how the ambulatory surgery centers do it, as well as for any kind of outpatient surgery. It's done by the 15 and then the 30 and that. In regards to, so these implants, yeah, these implants, the supply costs just keep going up. And so that's why there will always be an amendment, most likely, especially within the within, because of the R&D rules of the FDA, you actually have like up to 10 years where it has to be a certain price, but then it can go down and things like that. So there will always be amendment to these implants or things like that. But it is on us to be accountable to the people of Guam and to the legislature to make sure that we are right on task with the implants, because implants are not always covered by the insurance companies. That's what patients don't always understand. Like if I do a surgery, the implants that I use may not be covered within that cost of the surgery itself. So that is why we have implant costs, if that makes any sense.
Yes, and I have two questions. One is, are these rates, how does this relate to your overall, like, Medicare reimbursement rate? Do these have any effect on that? Does this bring us, like, because they're new fees, are we starting off with the correct Medicare reimbursement rate on these, or how does that work?
Actually, the one that SIETTE spoke about earlier with the APC, that's actually from Medicare. That's a Medicare rate. So for these accommodation and professional fees, we use the Medicare rate. For the supplies, we use the formula that was in our net revenue modeling code developed by Deloitte. We use that. So the problem with the charges is, yes, we will charge these to the patient. However, if the patient is covered by Medicare or Medicaid and they are an inpatient, these may not be covered by the cost themselves because we are reimbursed by a flat per diem rate.
So we're charging the correct rates, but we're reimbursed too low. I mean, when Medicare has another formula of how they reimburse us.
Yes, correct.
Okay.
And that's why it gets very complicated.
Yes.
At that moment in time.
All right. And then another question that just came to me yesterday is not directly related to the fees, but I was told, and I never knew this, that, so tell me if it's true, if you go into the ER and they test for methamphetamine or even marijuana, and that you test positive, that none of your charges are going to be covered by the insurance companies. Is that correct?
Yes, Senator, that's correct. Yeah.
Okay.
Anything that's our drug-related cases are not covered or reimbursable by insurance.
So if you go
Private
in with a
insurance.
heart attack and they test you for meth and you've got meth in your system, your entire heart attack fees, charges are going to be passed on to you.
There's some determination by the physicians, like, if the heart condition is like a long case or long disease of the patient, they might rule out some of that. But we cannot say that it's just because at the end of the day, it's still based on the documentation of our physician and how is the insurance going to consider the reimbursement.
All right. Does the Navy hospital reject cases and send them to GMH because they tested for drugs and they were positive? Is that happening?
I'm going to say I am unaware of that.
Okay.
Do I can try to find the answer for that,
Okay.
Madam Speaker, but I am unaware.
All right. I just wanted to, I never knew that myself either about insurance coverage, that it doesn't cover, and so I want everyone to know that if that's the case. So.
It's actually, we will bill the insurance, but it will more than likely come back denied based on the drug usage of the patient, yeah.
And just for clarification, because that exists in the insurance coverage policies, not
Right.
a GMHA policy, and that is actually a relatively standard exclusion amongst health insurance policies in the United States, that they don't cover voluntary illegal drug conditions as a result of voluntary illegal drug use. And so that it is a determination that's done by them after they get our medical records, but that is really on the insurance policy side.
Right. All right, thank you. Thank you very much. Is there anything else you'd like to add?
No, ma'am.
All
Thank
right.
you.
So thank you very much for your time down here and for staying on top of these fees. I know they've been very regular about it, so I appreciate that. And there being no additional testimony, the committee will consider this bill duly heard. I'm going to allow submission of additional testimony for the next 5 working days. That will be until May 17. Testimony can be sent to Senator Terlaje Guam at gmail.com or hand-delivered to the Guam Congress Building at my office. The time is now 8:50 a.m. Situs Masi. Thank you.